Let's talk health now. Nigeria has confirmed 39 new cases of Lassa fever in week 3, up from 33 cases recorded the previous week. Cumulatively, 405 suspected cases have now been recorded, with 93 confirmed infections and 17 deaths, putting the case fatality rate at about 18%. The NCDC says although the fatality rate remains high, it's slightly lower than what was recorded during the same period last year. The report also confirms that 4 healthcare workers were newly infected during the reporting week, raising concerns about infection prevention and control measures in health facilities. According to the Nigeria Center for Disease Control and Prevention, the cases were reported across 8 states: Bauchi, Taraba, Plateau, Ondo, Edo, Ebonyi, Benue, and Nasarawa, spreading across 20 local government areas. Data from the agency shows that 4 states, Bauchi, Ondo, Taraba, and Edo, account for nearly 90% of all confirmed cases, with Bauchi alone contributing almost half of the infections reported so far this year. Young adults between the ages of 21 and 30 are the most affected, while the male-to-female ratio stands at 1.1 to 6. In response, the federal government has activated the National Lassa Fever Incident Management System, bringing together multiple partners and sectors to strengthen coordination and response efforts nationwide. Let's bring in Professor of Virology, Professor Yewale Tamari. Prof, thank you for joining us on the news tonight. Good to see you again. The fatality rate is still around 18%, even if it's slightly lower than last year. Why is Lassa fever still killing so many? What are we still getting wrong in our response?
We're getting Thank you very much. I wanted to eagerly talk about it before I even greet you because of the way I feel about it. We are getting everything wrong about Lassa fever in this country. It's been with us for over 50 years. And we were setting up the technical working group at giving it in January. This problem starts every year, we know, in October. Why are we waiting till January to set an emergency operations center running every day, day to day in this country? We couldn't be waiting in January every year. It's not as if it's something new to us. We make it look like a Christmas, New Year disease. It's there with us all the year round. Yes, we have peaks in the dry season, but we know around October, November every year, this thing starts. Why are we waiting until January to set up the technical working group? What's wrong with us?
I'm looking at the data, Prof. 4 states, Bauchi, yes, Ondo, Taraba, and Edo, they say account for almost 90% of confirmed cases. Bauchi alone is contributing nearly half. What explains this concentration? What does it point to as to gaps in surveillance and public behavior?
Thank you very much. 2-3 years ago, it used to be Edo and Ondo State. Now we're seeing it's going to Bauchi, Taraba, which means the problem is spreading all over the country. Part of it is issue, as you said, issue of surveillance. While we're having 1 in 5 of the cases dying because they don't report on time to the hospital, because our surveillance is weak, because the states will not do what they should do. They're waiting for NCDC to do that. The cases are occurring in those places, not in Abuja. So why are state governors with all of this? Why are they waiting? What are the state ministers of health doing? Waiting every year for people to die before they listen. Now we're told 4 health workers are involved. You know what I always think about Lassa fever? You know what I think about Lassa fever before we can do anything good in this country? Let Lassa fever strike Aso Rock. Then we will do something in this country.
You talked about 4 healthcare workers now infected in just 1 week. From your experience, Prof,
yes,
what does that suggest? Are we looking at failure in infection prevention in our hospitals? And what other steps must health facilities now take in this regard?
You hit the nail on the head. Poor infection and prevention control and activities. Our doctors and health people should know now by this time that this is a problem that comes at this time. We shouldn't be having doctors and nurses dying. But again, it's also because we're not providing them with the required materials, the IPC materials for them to work, the gloves and all the other things that they need. Our government, our teachers, I mean, our politicians, and we go and buy great cars out of these simple gloves they can provide for the health workers. And they say they are making great fools of us, and they want us to be grateful for them. This is ridiculous. It shouldn't be happening in this country at this time.
We are seeing young adults, aged 21 to 30, most affected. There are more men than women. Is this a coincidence, or does it tell us something specific about exposure, lifestyle, or work patterns in Nigeria today?
The usual thing about this disease is contact with the rodents. And I would believe that we are getting more of the younger people they're getting more exposed to the rodents and the host. And that's why we're getting more of the younger people because they are more active. They go out and get this. While the elderly people may be a bit, not easily in contact with that. Those are these factors. They are younger, they go out there, they have the chances of contact with the rodents as compared to the older people. And that's the type of thing we're getting.
That's our time. Professor of Virology, Oyewale Tamori, thank you for your insight always.
Thank you very much. My pleasure.